Good day and welcome to another episode of Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. We like to call ourselves LIFTT, L-I-F-T-T. And LIFTT is the Center for Independent Living, or more directly, an advocacy and resource center for persons with disabilities, and we serve 18 counties in southeastern and south central Montana. My name is Jed Barton, and I am the Communications and Government Affairs Coordinator at LIFTT, and I am pleased to be hosting the program today. Our topic today, as you can see on your screen, is maintaining independence through occupational therapy, and my guest is an occupational therapist, Shelly Noel. She owns and operates her own practice called Montana Independent OT Advantage, or Montana IOTA for short. And Shelly is also a member of our LIFTT Board of Directors. Welcome to the program, Shelly.
Thanks, Jed.
All right, let's start sort of at the basic level. What exactly is occupational therapy? We've heard it, some of us, including myself, have had it, but what exactly is it?
So occupational therapy is part of the healthcare team usually that helps people do what they need to do, want to do, or they're expected to do. So oftentimes people know what physical therapy is, and I usually explain occupational therapy with that knowledge. So a physical therapist will help you get stronger, they'll help you be more mobile. They're the ones that you see in the movies where you break a leg and they help you to walk again. And the occupational therapist helps you do whatever you need to do once you get to wherever you need to go. And we are very much a holistic healthcare provider in that we look at the whole person. And we look at what they do during the day, but also in their life and what they want to do with their life. So we're about quality of life, wellness, health. We look at the body in the same as the physical therapist in that, do you have the strength? Do you have the range of motion? Do you have the coordination? But also, do you have maybe the mental capacity or the emotional capacity to be able to figure out what you need to do and how to do it. So those daily living skills, such as getting dressed, self-care, taking a shower, getting ready for work, actually doing the work, and even leisure. So if you want to be a bow hunter, or if you are a bow hunter and you've had an injury, then we would come in and help you figure out how to do your passion, whether it's taking care of yourself or getting to work or doing what you want to do on the weekends.
Neat. In your practice, which again, you mentioned that the name works out from Montana Independent OT Advantage, works out to an acronym of IOTA. Mm-hmm. You wanted to talk a little bit about that, but your practice is a little different in that you work in the patient's home?
I do. So traditional occupational therapy is usually in a setting, a specific, brick and mortar setting, with the exception of home health care. And so you would see an occupational therapist either in the hospital or in a rehab center or an outpatient center, for example, or when we work with kids, we go to the schools. And home health is the way the laws are written. Physical therapy, occupational therapy, speech therapy, we all can go in and under the home health agencies if somebody is homebound, meaning they cannot leave their home except for maybe doctor appointments or like beauty appointments in church. So I am a mobile occupational therapist, and I am an outpatient therapist, so I'm not seeing them in an acute setting. People don't necessarily have to be acutely sick. I work with people of all ages, kids and adults, where they're just not functioning and doing what they want to do. So, yeah.
Okay. And I would think, again, alluding to our LIFTT service area, which is 18 counties outside of Yellowstone County, all of which are pretty rural counties. There's not a lot of places for brick and mortar, so being mobile probably helps bring your services to places that otherwise wouldn't be, I would think.
Right, right. And since I'm just starting my business, there's definitely a steep on-ramp to that. But so take the critical access hospitals. Those are designed so that people in the rural areas can go to someplace a little bit closer than 4 or 5 hours if they live way on the eastern part of the state. They can go to those hospitals, but you're right, they don't often have access to rehabilitation services. And so the vision of my business is to be able to go to where the people are. And whatever that looks like, I'm open to whatever that becomes.
Okay. Yeah, in our work we've found it takes a lot of different forms, one may not imagine. So you mentioned the occupational therapist and the physical therapist. My experience as a grade school kid, I got to play when I was when I met with my physical therapist. I got to throw a ball and catch and stuff like that. And then when I met with the occupational therapist, I spent a lot of time trying to learn how to write using in shaving cream. So is that kind of the difference you were alerting to between the physical and the occupational therapy? That physical therapy, you work on the basic strength, and then occupational therapy is specific tasks?
So yes, and also how we use different activities. The physical therapist is oftentimes we look at more gross motor, and the definitions have definitely changed over the years, and both of our professions are trying to hone in on how we can be the best profession that we can be without necessarily crossing over and stepping on each other's toes, but no pun intended actually. But physical therapy, when I work with a physical therapist, typically they will help somebody, for instance, walk or be able to use what we call the gross motor functions, which requires a strong trunk and a strong, stable core so that you can stand up and not fall over, and so that you can walk. And in order to walk, you have to be able to lift one foot. And if you are having a difficult time walking and you lift one foot and you fall over, then the physical therapist works with the muscles and the strength in order to do that. And the occupational therapist it's the things that we do. So occupation kind of throws people off, and this may be one of your questions later, but it throws people off because people will say, well, I have an occupation, or I'm good at my occupation, or my occupation is I was a civil engineer. Occupation is another term for job. So what I say when I'm working with students, I say, all right, you are a student, that's your job, but you have little jobs in the day. So sometimes the teacher needs you to write. That's a job. And so I'm going to help you with the job of writing. Sometimes your job as a student is to cut with scissors. Okay, I'm going to help you cut with scissors. So we take the big job and we break it down into little jobs, and then even more little jobs.
Okay. It's again, that jives with my experience many years ago in the Lebanon, New Hampshire public school system.
And I'm sure you loved learning how to write.
Well,
it's a necessity, right?
Yeah, I won't show the viewers my notepad here, but it may not have taken. Um,
As long as you can read your own writing, that's
yeah.
okay.
Okay. So, again, are you often brought in through a doctor or through a school IEP process, or how do people get referred to your services?
That's a good question. In the school setting, it is oftentimes through the IEP process. And then outside of the school process, it's through a physician's referral. So people can get my services through either self-pay or through insurance, and because we're in the insurance healthcare provider, that's what our country does, then oftentimes my services are reimbursed through one of the insurances. And so in order for the insurances to pay for my services, I need to have a physician's referral. So it's like the pharmacist, I need to have that prescription. That's part of the check off the box in order for insurance to reimburse me.
And that includes both private insurance providers and the public Medicare, Medicaid?
Yes, yes, it does. And I also feel like in my business, and maybe in LIFTT as well, one of the ways that I feel like maybe down the road I might need to do is look at some grant funding, so that in lieu of going the healthcare provider route, I can maybe get my services reimbursed through grants. I haven't looked into that, but
yeah, that would be.
It's something to think about.
Yeah, it is something to think about as we look at alternatives to the existing healthcare model.
Right.
Right. For those of you just tuning in, this is Living Well in Montana from Living Independently for Today and Tomorrow, LIFTT, and our topic today is maintaining independence through occupational therapy, and my name is Jed Barton, and I am the Communications and Government Affairs Coordinator with LIFTT, and my guest is Shelly Noel, a occupational therapist whose relatively new practice is called Montana Independent OT Advantage, or IOTA, and you mentioned there's that's not necessarily unintentional acronym. So talk a little bit about what IOTA means to your business.
So as I was thinking of a name, which that's a job in and of itself, I did think of IOTA, and I thought about my vision and what I do and what makes me tick and why I'm passionate about occupational therapy. And the IOTA means little things, and the little things count. The little things matter. It is the little things that can make or break us. And I've seen that, over the years. Sometimes it could be just the little thing that I say that can tip somebody off into feeling like they can do something that they, before we start working together, they don't think that they can do. So the little things matter to you, they matter to me, and I try to pay attention to those little things. So I try to listen to those things, I look for those things, and that's why I came up with Montana IOTA.
Oh, neat.
Yeah.
And like we said, the business is relatively new. Are you relatively new to the South Central Montana community?
I am. We've been here 4 years.
Okay, and what's your background?
How do we get here?
Yeah, sure.
Well, 5 years ago, I got my doctorate in occupational therapy,
Okay.
and I wanted to teach, and so I ended up here at a teaching position, and taught both at the University of Mary at their satellite office here in Billings, and then also at Rocky Mountain College for their occupational therapy doctorate program. And then it was time for me to just branch out and do my own business. So here I am, and that in and itself is a story.
And was your doctorate from Rocky then? Or?
No, it was from, it's a post-professional doctorate from Rocky Mountain Health Professions in Provo, Utah.
Oh, okay. All right. So you have some experience in the Intermountain West, if not Montana. What are the, maybe we can talk about what do you see as some of the unique challenges to providing services in a place like Montana?
So I think one of the reasons I'm here is because I do have lots of years of mountain living, in that I lived in Colorado for 20 years. And then my husband and I have done some overseas work where we've been in rural areas and populations where people don't have access to the cities. So we've spent some time in India and Turkey and some of the former USSR countries. And so I saw a huge need there and saw how people had no access to occupational therapy, and they couldn't, and even when they could get to the cities, because they were third world countries, they didn't have much access to occupational therapy. So I have a heart for that, and so when I got here to Montana and saw that the similarities are very great, I think I decided it was time to put boots on the ground and work in my own country.
Neat.
And so also in the rural setting, you had asked, like, how do I see maybe my services could help? Initially, I'm in Billings and I'm working in Billings, and I feel like once the concept and the idea gets out that a mobile occupational therapist can come and work with people right where they're at, I think that one model would be to do what one of my colleagues has done in Alaska, which is to be able to go to a rural community, be able to have enough clients there to be able to do services and do what I need to do, and then revisit them at a later date. And so depending on what the need is, traditionally an occupational therapist will see somebody, as you know, either once a week or twice a week. But because it's so rural and there's fewer of us, then we need to modify that model. So I would need to go out, see somebody, work with them, give them their homework, and say, here, work on this, and I'll be back in a couple weeks.
Yeah, very familiar in the work we do at LIFTT. Again, we have offices in Billings and in Glendive, but we have this enormous service area that includes 18 counties, and if it was its own state, it would fit somewhere, it would fit between Pennsylvania and Mississippi in terms of the size of states. So again, it's
a lot of geography.
Area, and a lot of our folks do spend a fair amount of time on the road. I liken it often to the old, and now it's coming back into vogue as the number of clergy reduce, riding the circuit.
Yep.
As they called it.
Yeah, that's a good analogy.
So do you see and again, a lot has been made of during the pandemic particularly, but even before the pandemic, of expanding access to things like telehealth, and again, in setting aside the obvious technological divide that in our rural communities, if the technology is, if the technological infrastructure is in place, is there a place for that in the occupational therapy realm, do you see here?
Yes, I absolutely think that there's a realm for telehealth in, especially in rural communities. And there's talk of that at the national level, that if we can work through the governmental policies, that can happen. And I think one thing I'd like to mention is that in my work overseas, I very much noted that there are different cultures. And so the culture of Montana, because I've lived in so many different states, is the culture of Montana. And so if you're working with somebody in a rural setting, their culture is different than somebody in an urban setting. And I feel like as a occupational therapist, going out into the community, I need to be very aware and cognizant of what their needs are. Not what I think that they should have from my viewpoint, but from their cultural, their rural, their perspective.
And meeting, again, that fits very well with, again, the philosophy of an Center for Independent Living. We try to meet we call them consumers. We try to meet them where they are at. And it sounds like you're doing something very similar.
Yeah, very much so. I every single person that I meet, I don't have an agenda for them. I really don't. They have an agenda. They have a passion. They have a need. They have something that they want to be able to do. Either they used to be able to do it and now they're not for whatever reason, or they know that they maybe should be able to do something, but they just haven't been able to figure it out. And so I like to join people, like we were talking earlier, in their stories, and to be able to say from a different perspective, all right, I see it too, let's go do it.
Okay, and again, we've got about 6 minutes left or so. Maybe, and again, obviously within the realm of confidentiality and maybe you can share some examples from your work, or
I can.
particularly,
I can.
sort of, some of the stories that you've heard over the years.
One comes to mind is a retired airline pilot who has had polio when he was a child, and it was probably in his 80s, and I had been talking to the senior living community that I was working with and telling them, look, if you're having trouble doing what you want to do or need to do, look me up and we'll get you a referral, and I'll come in and I'll work with you and help you be as independent and safe as possible. So this gentleman came to me and came into my clinic, and he just said, I think I need your services. And he was a little disgruntled. And I said, okay, well, what's going on? He's like, well, I'm falling all the time. And so I went into his home, and sure enough, he was falling several times a week. And he was tired of it, and he knew, because I've kind of been talking to the whole community, look, falling is not a typical thing that an adult needs to be doing, so we need to stop that. And so I ended up working with him, changing some of the ways that he did things, and at first he was a little bit grumpy about that because I was interrupting his coffee routine in the morning, or even how he did his showers, because he had it down. He was an airline pilot. He knew how to, twist every little thing to the very nth degree, the little things, right?
Right.
And so I just kind of made a few shifts and worked with him, and we tried a few different things, and he kind of augmented some of the suggestions that I gave him, and after just a few sessions, he was able to take a shower independently, get his coffee in the morning independently, and he had stopped falling. And he came into my clinic. He said, all right, you just made a believer out of me. You took a stubborn 80-whatever-year-old man, and I thought I had it figured out, and I didn't. So that is probably one of my favorite stories.
Yeah, that sounds very familiar to those of us with aging grandparents and parents.
Yeah.
You also mentioned working with children. Is it again, going back to my own experience, is it sitting down with a kid and helping them and learning to sort of like I said, I remember tracing letters, and is that still what often you do with primary grade age children? Or?
So the daily life, it could be anywhere from, are they getting ready for school and they need more help than their parents know how to give them, and they're all, screaming and yelling at each other. Or I have a young boy who's elementary school, and his parents could not get him to brush his teeth, and he wasn't brushing his teeth, and it was a real struggle. And so now he brushes his teeth. I worked with him, and we had lots of fun. We spent lots of sessions, but now he's independent brushing his teeth. He does it right. He does it well. He does a good job, and there's no more battles.
Okay, that's neat. So a whole range of experiences based on age and, again, what the person, much like you said, again, it sounds like, again, you're very much in line with the independent living philosophy. When people come to us at LIFTT, we like to say it's your train, you're driving it,
Right.
we're just board, and it's their goals
Yep.
and their vision for what their life should be, and it sounds like you play into that same philosophy, which is wonderful, and great to have you on our, again, as part of the community here in Billings and as a member of our board of directors. And
Yeah.
so thank you
excited
for
about
that.
that.
Thank
Yeah.
you for that. Let's see, I think we're just about done here. So again, I'd like to thank our guest today has been Shelly Noel of Montana Independent Occupation OT, Montana Independent OT Advantage, or Montana IOTA. Does Montana IOTA have a website or something where people can find out more about it?
Yeah, it's mt-iota.com.
All right, thank you. And again, my name is Jed Barton, and I am the Communications and Government Affairs Coordinator at Living Independently for Today and Tomorrow LIFTT, and you've been watching our program Living Well in Montana. If you're in need of LIFTT services, you can give us a call at the number on the screen, 406-259-5181, or you can look us up online at www.lift.org, or you can find our brand new mobile app in the Apple or Google Play App Store. You just search Living Independently LIFTT, and it comes right up. If there's obviously that LYFT LIFT is a few billion downloads ahead of us, but we can be found. Thank you, and have a pleasant day, and we'll see you next time. Thank you.